Good morning, Zimbabwe, and welcome to Zimbabwe Daily. My name is Yvonne Muchaka, and I do hope I find you well. Today, we are on lockdown level 4, day 3. I know we've been on lockdown for a long time, but it is only now that we're getting back to level 4 because the cases of COVID-19 have continued to rise just within the festive season. So, on the line today on the program, as we take a look at the happenings on day 3, I've invited Dr. Takavafira Zhou. Dr. Zhou, welcome.
Welcome, and how are you, my sister?
I'm very fine, thank you. How are you doing in this COVID era?
Well, COVID era is a challenge. We are surviving.
Okay, no, that's fine. Yesterday you issued a statement as the president of the Progressive Teachers Union of Zimbabwe, in which you were saying COVID-19 is running riot in our schools. Can you give us a brief analysis of what is happening in the schools?
Well, COVID is running riot in our schools. Just 2 days ago, more than 50 school heads tested positive. Several school pupils and several other teachers have also tested positive. And as a nation, we seem not to have a broad-based plan to react to COVID-19. So the crisis in schools is that we really cannot come up with a contingent plan to ensure that there is health and safety in schools, the health and safety of teachers, the health and safety of pupils is catered for in schools. So we seem to have lost the battle to COVID-19. And as of now, there is no coherent plan over what to do. And in this crisis, those who want the services of teachers must be prepared also to invest in monetizing the health and safety of teachers. So this is where we are, where teachers cannot continue to go to school in order to die. There is no life after death, and teachers also need to survive. Teachers play a vital role in societal development, and their lives are also important because they are managers of the world's best asset in terms of young children. But their safety and health in schools is not prioritized in Zimbabwe, and as such, the only way forward is for teachers to stay in their respective homes until the government can come up with a contingent plan to ensure that their lives are protected, particularly during this time when people are writing their examinations.
All right, thank you, Dr. Zhou. Maybe just I'm asking this question. Maticha akambo testwa here. Young people are going to be
we have in Zimbabwe.
Writing exams. Maticha zacho akambo testwa here kuti azive kuti akamira sei.
Haana kumbotesta muZimbabwe. Ndiyo challenge yatinayo yatiri kutaura hurumende kuti vanhu vasati vaenda muzvikoro zvinodawo kuti tive nama-testing kits, titeste maticha, ancillary staff nema-students. That is not done. The government believes kuti vanhu vanofanira kungoenda chete kuzvikoro kana vazorwara votestwa. And so you are saying prevention is better than cure, and we must ensure that we have adequate testing kits so that we test teachers, pupils, and ancillary staff before they congregate in schools. So that's where we have a crisis and a challenge, and our professional advice is not being considered in the education system, particularly by the Ministry of Education.
What is the ministry saying? I think what we have seen over the festive season was that the children will write their examinations and finish in January. And you've mentioned that we've got 50 school heads who have tested positive for COVID-19. What has the ministry done, or what is it doing in light of that information?
The ministry is not doing anything except now becoming more and more silent. We have several others that tested positive to COVID last year, and such as have not received any assistance. A number of them, we have encouraged them to approach the districts, the province. They have not yet received any assistance. All what the ministry was doing since last year was to close schools that were most affected. And when where schools are most affected, for example, a school with the students that are more than 1,500, that will go there with about 47 testing kits. And with 47 testing kits, 32 students will test positive, and thereafter the school will be closed. With a number of students with moderate and mild effects that resonate with the COVID to go to their various homes without verifying their status or protecting their family members. So it's a crisis. This is a crisis that is continuing in schools. We've had cases where students who are COVID positive had to travel to their respective homes, their families. Now they are back congregating with other people. They are not tested, and the government expects them to write examinations, and they expect teachers to invigilate without verifying the status of teachers, the status of students, and ancillary staff. And this is a dangerous situation in any country, and we really want to come up with a broad plan that prioritizes the health and safety of teachers and pupils.
Right. Last year, we had schools like Cholocho High and others that were closed because of COVID-19 cases that were reported. Are the students from those schools that were closed last year due to COVID, are they writing examinations now?
Yes, they are writing examinations. Not only that, they also traveled back to their homes and infecting also their parents, their relatives, and now they've traveled back to school in their boarding schools, and they are writing examination work, proper verification of who is infected and who is not. And we only have nothing but thermometers, just testing temperature, and most of the thermometers are defective. They are not giving appropriate temperatures, and this all simple technology that we have, no other PPEs, testing kits, sanitizers, except thermometers that are defective. And it's terrible in a country 40 years after independence.
All right, so we're coming to you live on Zimbabwe Daily, and we are talking to Dr. Takavafira Zhou of the Progressive Teachers Union just to get an analysis of what the status in our country is in terms of the education sector. We know that schools are opening even in this midst of the crisis that COVID-19 has placed all of us in. Vice President Constantino Chiwenga, who is also the Minister of Health, said that the nation was moving into level 4 lockdown, in which all sectors have been shut down except for a few that have been considered essential. And on top of that, the schools have remained open. So we're just having this conversation to find out how safe our children are as they're writing their examination. Dr. Zhou, what would you have done given that our students were supposed to write last year, they didn't? What would you have done if you were the government?
There are so many ways we could have done. The most important aspect is that before students could come back, there is need for testing of students and test teachers as well as staff. Apart from testing, the other alternative was to postpone these examinations because there is no need to rush over examinations and compromise the health and safety of both the teachers and the students. So there are quite a number of issues that would have been done, other than providing adequate PPEs, other than testing and also ensuring that those who are infected are separated from those who are not. We could also have postponed examinations until an opportune time when we're in a better place, because there's no need to rush over these examinations. After all, where are these students going? Where are these teachers going? We have several other students, we have several other teachers that are unemployed. We have over 95% unemployed. There's no need why we should rush over things when we could adopt a sober approach and a more reasonable and a palatable way in order to protect the health and safety of the teachers. So quite a number of things that could have been done apart from the issue of ensuring that test both teachers and students and provide the equipment, COVID equipment, and still have postponed the time for writing these examinations until the situation has improved in Zimbabwe.
Is the situation going to improve, sir? Because from what we are hearing, we may actually have COVID-19 for the long haul. Do you see the situation improving, or we may have to come up with plans to make sure that we live our normal lives in the midst of the pandemic?
Yeah, I totally agree with you that the situation may not improve immediately, but ultimately the situation may improve, particularly after June. But there are also methods that could have been used rather than sticking of writing examinations. We simply could have used the coursework. These are students that have been learning, those who are in O level, they've been learning since they were in Form 3, they were also learning during the course of the first term. The same applies to those who are in A level. They learned throughout the time when they were in lower 6. They also learned during the course of the first term. We simply could have used the coursework to come up with their marks, and instead of jeopardizing their life or putting the life in danger, use the coursework to come up with the exam marks or the marks for this for 2020 academic year. That still could have saved a number of lives in that situation, exposing teachers and pupils to COVID pandemic unnecessarily when we have better options than sticking to the routine writing of examinations.
Right. And besides COVID-19 coming on and throwing our whole life into quandary, as teachers, you already had sitting issues that you were raising with the ministry and with government. Would you like to highlight some of the challenges that teachers have already been facing before COVID-19 that are now being compounded further by the pandemic?
One fundamental issue that faced teachers was the issue of welfare of teachers. Teachers were earning a salary of about 520 US dollars. That salary was reduced to the current equivalent of 140 US dollars. So there's been the erosion of teachers purchasing power parity, and teachers wanted the government to ensure that they restore the salaries that teachers earned as far back as October 2018. Because of that, teachers cannot also be in a position to travel to their workplace. Transport has gone up, accommodation has gone up, utility bills like electricity, water bills have gone up. Teachers also have to pay fees, and their own children cannot access the services that they are rendering. So it becomes very difficult, for example, for a teacher to report for work and teach other people's children when he or his own children cannot access that service. So there is quite a disparity between what teachers are earning and the fees that are demanded by government, as well as the exorbitant prices of basic commodities or life expectancy or the life, a lot of basic commodities are very high and teachers cannot make ends meet. So teachers have tested to poverty and their salaries cannot ensure that they can live a decent life. Yet teachers play a crucial role as a vital core of societal development. These are some of the challenges where we expected the government to ensure that the teachers live a decent living and play a crucial role in the development of young children.
Right. And in your statement yesterday, you said that because there's this lack of prioritization of teachers' safety and the students' safety, you were advising teachers to stay at home and save their lives. Now, Tofamba say, how do we then get to where we want to get if everybody is staying home and the students don't write their examinations, and on the other side we've got government saying we need to open up the schools, children need to go and write the exams. We've got a government that then says if teachers don't want to come, you can go and we will replace you with other teachers who are actually not going to work. How do we balance between the two?
Well, the reality of the situation is that the government must mellow down to a more constructive approach rather than adopting an intransigent and irresponsible approach. Fundamentally, government has declared the lockdown. Teachers really have no money to go to work, and they need also to survive. Their priority, their health and safety is not prioritized. They go to schools at their own peril. So teachers cannot really go to work and dig their own grave. All what you are saying is we are ready to work and to maximum effort, but we need also to survive. Our health and safety must be prioritized. We are also workers and not slaves, and we must be treated with all the due respect. All the labor regulations must be respected. ILO regulations, whose standards must be respected rather than anything else. So it's an issue of life and death. As much as we want to work, we also want to survive, and we don't want to die. If there are other teachers who are free to die, let government then engage those who are free to die. And we can only come back to work when our health and safety are prioritized. This is an issue of life and death, and we are not careless. We really want to survive and to play an important role to the development of the nation. But we can only play that role when we are alive. We want to die, we want to exist and continue to play our important role, but governments also ensure that our lives are protected. And this is where we have a bond of contention with the government that protect our lives and we can offer our services. But if you don't protect our lives, we cannot continue to offer our services because we are not immortal, we are human beings.
Yeah, but you've got a $500 dying incentive.
So we don't want to benefit after dying. We want to benefit before we die. So this scenario of trying to benefit when you die, how do you ensure that you benefit? You may not benefit because you may not even have beneficiaries to claim such benefits. We want benefits that would benefit or that would accrue when we are still existing. This aspect of putting about 500 our death bed, I don't think it's palatable. We want really to survive, and all the benefits must accrue when we are still existing.
All right, Dr. Takavafira, thank you so much for the time that you have shared with us. Maybe if you've got last words that you'd want to share with your constituency, the teachers, and also to our policymakers who will be listening into the program. What should we do? My exam said, my exams. Should we really stop now? We've got 50 headmasters who have already tested for COVID-19. We definitely have some teachers who have tested, some who have self-quarantined. So what then is the message? What is the clarion call to our government and to our policymakers before we end?
The message is very clear. As teachers, we are ready to put our maximum effort. But the most important thing is that our activity must be prioritized. If the government cannot prioritize our health and safety, it is better to look for other safety methods like using coursework than try to jeopardize the lives of teachers and the very students that we want to ask. That students can only also benefit in future if they are alive, but you are jeopardizing the life of teachers and the students. So it is better to close schools than to jeopardize or kill teachers and students until government can come up with a better method. So the issue is about health and safety. Without health and safety, let's close the schools.
Right. Do you feel, just the one last question, do you feel the issue of COVID-19 has been advertised, has been spoken about, has been sold to the people as a health issue, or it has become maybe a security issue, as Rashid Mukundu said in our last conversation? Do you feel that our health education around COVID-19 has been enough or has been fair to deal with all the aspects of our society?
No, it's unfortunate that health and safety issue have not been highlighted. If you go to the rural areas, for example, you find people drinking from the same cup, drinking their 7-day beer and the like. So the whole essence of marketing or health and safety it's neither here or there. I think as a country we have failed a lot. We seem to just embark on rhetoric. Even the resources we have not reserved enough resources to conscientize people about the health and safety. And as such, even schools, we don't have the necessary things like sanitizers, the PPEs. So it's more about propaganda than reality. But we can't really embark on a holistic because on issues that have to deal with life and death. So rather than resorting to holistic vehicles or to propaganda, I think the issue of health and safety needs its own experience and needs own it needs practical issues rather than lip service. So we really need to go a long way and to ensure that we invest in COVID abatement equipment that we must put in schools in particular. But unfortunately, more often than not, we are more prioritizing on propaganda than fulfillment of simply putting PPEs in schools. We have failed to do that. So we are still miles and miles away from prioritizing health safety schools and as well as even among society in Zimbabwe.
Right. And Peshi comes through and says most kids are running late for exams because of the delay at the roadblocks and just general lack of transport. Are you facing such challenges with your, are your students facing such challenges where you have covered in terms of your feedback from the teachers?
Yes, because we don't have a broad plan. For example, many students are rushing to write examinations. Police do not care about that. They don't even know that their students, they are more and more interested in store people and perhaps making money. We should have come up with a broad plan, perhaps coming up with super buses that are specifically carrying students to examination centers. But we don't have that. That's why I was saying that the government has not come up with a broad-based plan to ensure that you fight against this COVID pandemic. They've left everything to chance, and there's no agency in taking people to these examination centers. That's why we're even also urging our teachers that they would die because there are no specific cars, buses to take them there. They have to ask in a number of these public or private cars and risk their lives in trying to save the nation. So we really have a long way to go, and until we come up with a broad-based plan, it will be better for government to consult widely and ensure that they do the rightful thing. Otherwise, these examinations would leave us worse off than just ignoring them until an opportune time.
All right, Dr. Takavafira Zhou, thank you so much for your time, for coming through to us. You are in Gweru, right?
No, I'm Masingo.
You are in Mashingo. All right,
In
thank you so
Masingo.
much. Thank you so much for coming through to us and granting us this conversation around what is happening during this lockdown level 4, day 3. Thank you so much, Dr. Zhou.
Thank you very much.
Awesome. All right. Thank you so much, Zimbabwe, for joining us.
All right.
I think statistics that have been showing in the last few days have been quite disturbing. Zimbabwe is now recording high single-day rises in COVID-19 cases, forcing the government to impose the 30-day national lockdown to curb the spread of the virus and fatalities. On the 1st of January, the country recorded 217 new cases and 6 deaths in 24 hours, which cases doubled on January 2nd to 407 cases and 8 deaths. On January 3, Zimbabwe recorded its highest single-day rise with 774 people testing positive within 24 hours. On the 4th of January, 564 cases were recorded of the coronavirus with 4 deaths. The total death toll stood at 384 deaths countrywide, while as at 4 January, there are 15,829 confirmed cases nationally, with 11,716 recoveries. Of the 15,829 cases, the number of active cases is 3,729, and the Ministry of Health and Childcare said the national recovery rate stood at 74%. Although the Ministry of Health and Childcare has not officially announced that the country has entered the second wave, there are fears that the rapidly spreading new COVID-19 virus cases are due to the variant in South Africa, considering that the borders were reopened and that there was lots of movement to and from Zimbabwe. South Africa is currently experiencing a second wave of the pandemic and noted a highly concerning new variant of COVID-19 known as 501Y-V2, suspected to be fueling a rise in cases. The emergence of this new variant coincided with what the Africa Center of Diseases Control called the second wave of COVID-19 in Africa, in which the number of infections and deaths has risen in some countries. The staggering numbers also come as African countries are waiting on a COVID-19 vaccine. So we hope to have a conversation tomorrow with the medical doctors and such, so that we can also hear if Zimbabwe is making strides and making any efforts towards, doing a little bit more research and investigations, and peradventure, preparation of a vaccine that is locally produced that we can use in order for our nation to be immune to the coronavirus. Nicholas, Baba Chantal, and Adrian Dendere said that corona yatipedza power. Indeed, but there's one thing that I know about Zimbabweans: we are fighters and we'll definitely defeat this whole thing. Let us mask up and let us make sure that we keep each other safe. Sanitize your hand, practice social distance, and make sure that you follow updates. Above all, let us continue praying, because we can and we are more than conquerors. Have a wonderful rest of day. God bless you, Zimbabwe, and may we continue to be positive.